How's it going, everybody? My name is Jesse and welcome back to Male Nurse Mentor. Here we are with another video. I just want to continue to find a way to give back, give value, add value for you guys on your journey to becoming a male nurse or a nurse in general. So I wanted to do another Q&A. I felt like it was about time because all I'm trying to do is provide some information that I would have found helpful back when I was starting on this path. That's the main goal of this channel, and hopefully with the main audience to be men, right? Because we're not really being represented in the nursing field quite yet. We got a long way to go in order to get that percentage up, but I think we're doing a good job. But anyways, friends, as I've done before on prior Q&As, I think I've done one before. I'm gonna put the post with the person who commented and their question on the screen. I'm gonna give you guys a shout out and we're gonna answer these. I've only read through these comments once when I initially commented back, so it's gonna be a pretty raw take. I'm just gonna read it and give you a raw thought, right? Just give you my take on answering these questions. So this is a Q&A, but also I just wanted to point out, if you guys wanna reach out to me just directly, you have a very personal question, I always have my DMs open on Instagram. It's the same name as my YouTube channel, Male Nurse Mentor. So with that said and out the way, let's get to this video today. So friends, the very first question, it comes from Couch Potato 725, shout out. And their question reads, I just realized I was curious about travel nursing. I know it's not your forte, but I'm sure you might have thought about it someday. So what's your take on it? It's good money, but is it worth it? Why won't you consider it? So travel nursing, friends. My initial thought that comes to mind is you can make a good amount of money. I know during COVID-19, just as an example, I worked in a prison, actually employed by the site, and I had travel nurses besides me, working besides me, making twice as much as I did. And that was during the COVID-19, really big pandemic. But with the pandemic aside, one thing with travel nursing that comes to mind is you have an opportunity to make more money because you take on assignments, right? Sometimes there's less benefits, sometimes they do have benefits. So there's pros and cons with it, right? The main thing that comes to mind though, I guess I should just say, is you have an opportunity to make pretty good money. And you also have a lot of flexibility. You can move around to different places. A lot of people travel. They'll kind of go state by state and kind of move around. I've known some nurses that have an RV and they kind of move around in a mobile type home and they kind of do their assignments, take time off for a bit, travel, take on another assignment, and they kind of move around. I think the biggest drawback for me is just all the movement. A lot of it just depends on who your partner is and how mobile you guys are as a unit. If you're a single individual, moving around like that maybe isn't such a big deal. But if you have a family and kids, it could be a lot more difficult. So that is kind of another draw. The plus overall, I would say, is you can make money, you have a lot of flexibility, and I think another big plus is you don't stay at a facility long enough, potentially, right, to get the drawbacks of the culture there. Sometimes when you're employed full-time, you get sucked into a certain work culture that can be kind of toxic. Another negative to travel nursing is, maybe you're not accepted. They can also give you the hardest assignments. So I know I'm kind of moving back and forth with a lot of initial thoughts, but that's the main thing that comes to mind. It has pros, it has cons. So for me, just to answer lastly, is it worth it? I think it is worth it. I think it's worth it if you want to make money, you want to have flexibility, or maybe you don't actually want to be part of a work culture. You don't want to stay at a facility long enough where you kind of get sucked in. If you don't like it, hey, I'm out. You do your assignment and you bounce. The drawback though is you're not anywhere long enough where you don't really get accepted into that space, right? But maybe that's not what you're looking for. Another con is the movement. I can't even say instability because you're always going to have opportunity for assignments. It's just a matter of where they are. For me, it doesn't really work so much, but it can definitely work for people. A lot of people do it. So for this next question, it comes from Joshua the Dog 3881. And their question is, I was wondering about what advice you have on being proactive and involved during clinicals for a first-year nursing student with limited clinical experience. Cheers. Happy New Year's. I forgot that part. So friends, my answer to this, and I get it, first semester going into your clinicals with limited clinical experience, it could seem pretty daunting. Like what are the ways to navigate this? The best way is you just gotta go in with an open mind. You gotta go in understanding you're new. You're not gonna know a lot. So leverage that and just ask a lot of questions. Ask a lot of questions, learn a lot as you get these answers. observe, shadow, try to get involved. Even if you don't want to be hands-on, it's okay to just want to shadow, but do a good job at shadowing, right? If you know a nurse is going to go stick an IV, go and follow them. If you know they're going to go insert a Foley cath, go and follow them. Ask them at the beginning of your shift. One thing I used to do is I would ask at the beginning of my shift, right? In my very first semester, hey, if it's you or someone else, you know, if someone's going to do like a skill, would it be okay if I watch, right? My nurse would be like, oh, you know, today I don't plan to do any specific skills, but you know, my colleague is, so maybe when that time comes, I'll go get my colleague and I'll try to coordinate for them to be with you during that time so you can watch. And you know, that's one way to kind of navigate this. But that first learning curve, trying to get into clinicals, it's gonna feel awkward, it's gonna feel uncomfortable. That's normal. You know, you're new to this setting. You probably haven't been, the way I break it down is you probably haven't worn scrubs in a hospital setting or a clinical setting just in general, right? So it's gonna feel a little daunting, a little stressful, scary, anxiety inducing. That's all normal. So my advice is try to see as much as you can, shadow as much as you can, see as many skills as you can. It's okay to not be hands-on at first, but because of that, leverage the opportunity to observe and be new. And people understand. People understand you don't want to be hands-on, and it's okay. Eventually though, you're gonna get the confidence because you've seen it. You get the confidence working with the preceptor over time. You know, they're gentle with you and kind of move you along slowly. And over time, you kind of build your confidence up. And then eventually you go from hands-off to hands-on. And even when you do that transition, just know it'll still be tough, right? When you go to do your first IV or your first Foley, take your vital signs even for the first time on a very critical patient or just a patient in general, you know, it's all new. It's all a new experience. It's gonna feel uncomfortable. So hopefully some of that is helpful. The biggest takeaway here is leverage the fact that you're new. Use it to your advantage. Hey, you know, I'm new, I've never seen this before. Can I watch? Can I observe? If you're gonna do something, or if you know maybe one of your colleagues who's gonna do something, it's okay if I'm in that room. So that's what I would do. That's what I kind of did back when I was first starting my clinical rotation. So this next one, bro pillar, shout out. So advice for a new grad nurse just starting. So for someone who just graduated, you're a new grad nurse entering the workforce, I would say, you know, allow yourself the patience to apply for positions, even if it's not like the one you truly want. And what I mean by that is, you know, we all have this idea coming out of school of a position that we do want, but you got to understand, you're a new nurse. You have limited experience on paper on your resume. So you may actually need to pick up a position that you maybe aren't truly a fan of, but then you could eventually leverage that for an opportunity down the road that you actually want. And what I'm saying is, like, let's say you want to work the ICU one day, right? And as a new grad nurse, you're trying to get the ICU position, but then you have to settle for like a cardiac floor position, right? That's still good experience. Or you have to settle for a med-surg position. Well, leverage that. Work as a med-surg nurse, keep your eye out for ICU opportunities, and then kind of get to the place you eventually want to go later down the road. So just be patient with yourself. You know, for me, as a new grad nurse, I also didn't like the hospital setting. So for me, I had to think outside the box. Hey, where am I going to fit in? I went into correctional nursing. That's just a big general piece of advice for someone new out of school with your NCLEX passed, trying to get a job. And I think that's a big one, because I know getting that first job is a big stressor. If you can get into a new grad program, even better. But if you can't, you know, don't stress the fact that sometimes you just have to get in, get a position, get experience, and then move to the department you actually want to get into. So they also wrote, socializing with coworkers who are predominantly female or dating. So this one's always going to be an interesting one to answer, right? Now you're a new grad nurse, you're going into the workforce, you're going to be working around a lot of women, right, as a male nurse. I think the same thing still applies in terms of the advice I gave for male nursing students in nursing programs. Is just be careful, be mindful, be conscientious of the choice that you're going to make in the same setting, right? Whether it's nursing school program or nursing floor, right, with your female colleagues. You work there. It's the same thing as if you worked at, you know, Aeropostale as a teenager, right? You work there. If you date someone who works there and things go south, it's gonna be a little awkward. You may eventually need to leave that job, move to a different department. So just keep that in mind. If things are great, cool, but if things go south, it's not great. I always tend to just stay professional, you know, when it comes to a work environment in general. I don't really get to that extent with colleagues. For me, fortunately, I've always had a partner, have a partner today, but just in general throughout my life, I've always realized that it's best not to flirt or make moves on coworkers, because if things go south, things go south and it's not gonna be good. Someone's gonna have to go. You gotta go or they gotta go, right? So just keep that in mind. I would say start slow, right? As a new grad going into the workforce, start slow. If you're trying to find a partner, preferably try to find a nurse partner or someone else, right? In the hospital, wherever it is that you work, in another department. That is my general advice if you're gonna do it. You know, do it in a different department, maybe in a different role, maybe a respiratory therapist or a physical therapist or something, right? There are workarounds, you know, but just be careful with that when you make that choice. That's all I gotta say. So then the next one is budgeting on a nurse salary. So this is a good one. I really like this one. For me, finances has always been a big part of what I wanted to do in life, right? Is have my finances tight and in order. I've always been financially savvy in a sense. I've always thought about the future and where I would be and where I want to be financially. As a nurse, or I guess I should backtrack, one of the main reasons I became a nurse was because I knew the income was good. I knew I would have a sufficient shovel, right, in this life to build whatever it is I wanted, right? Yeah, not get a huge house in Miami, right, beachfront, but I knew I would live well. And that's still my plan. And currently, I live pretty good, right? I'm at the beginning of my career, I have a long way to go, but I knew that a nursing career gives sufficient income. But now the thing is, you made the money, now what do you do? Well, have a plan, right? If you have school debt, prioritize that, but also start to invest right on the side or think about retirement. For me, I started thinking about retirement even before I got into the workforce. I worked for the state, so on the back end, I've been putting money into a pension, right, automatically. But I also started a dividend investing portfolio on the side. I do have a channel, it's called ContinuesToTick. If you're curious and you wanna just follow that, you would go to that channel. It's also, I think, featured on my page here. But just in general, as a nurse, don't go out and buy that BMW after your first 6 months of working as a nurse. I recommend against that. Be more mindful, come up with a strategy. For me, I know I wanna live better in the future than how I live now. Some people want to just go ahead and buy the Tesla now and not think about the future. So it's really up to you, but think about your finances, be smart about them. You make good money as a nurse. Now use that good money to structure a good life. That's my biggest take. If you have any specific questions on this, you can always just reach out to me with a couple questions. I'll give you just a couple ideas of what to do. But again, I'm not a financial planner, but I'm always interested in finances. I like that. So another part of this question is living life and doing shift work. This is always a tricky one. It took me a while to fully find a work-life balance that worked for me. And as a new grad nurse, it's gonna be a little difficult too, right? Because you're probably not working in the department you want, and because of that, you're also probably not working the shift that you want. Oftentimes, new grad nurses do or can start on night shift, right? Or you work odd hours. You work a shift that you're not really a fan of, right? Because you just wanted to get your foot in the door. So for me, you know, first out of school, it was tough to find a work-life balance that worked for me. I got employed at a county jail that was about an hour and 15 minutes away from my actual home. I worked there for a couple months. I saved up money, eventually got an apartment, moved in with my partner, and that was kind of the sequence. I didn't really have much work-life balance when I first started. I also wanted to make money, so I was actually working more overtime, right? So as a new grad nurse, focus more on just stabilizing yourself. I say, make money, save money, buy a couple things you want, but for the most part, you know, hang out with friends when you can, hang out with family when you can, take those hikes and those rest periods on your days off. But when it comes to shift work and trying to balance in your life, don't stress out too much about this in the first year. Everything's gonna feel pretty stressful anyway. Just find what works for you in the meantime. I eventually, 4 years, 3 years later, I started thinking about personal development. That's when I really started to kind of hone in on eating right, trying to build up my relationships, build up myself, clearly like have more time to do a YouTube channel. It took a while to get there. Sometimes it takes a while to find that balance. Sometimes it also takes the right schedule, the right job. So just find what you can in the meantime. You know, start small, little things. If you can meal prep, make good meals, do that. If you can hit the gym a couple times a week, do that. You know, for me, I look at life as a journey. Start small, Take little steps when you can. And eventually, when you have more mental bandwidth, a more appropriate headspace, then start to add and build the person that you actually want to be. But be patient with yourself. Show yourself compassion. That's my biggest tip with that. And then the very last part of the question, and I love all these questions, these are really good. How to make a good impression at work. So for this one, it's easy in the sense that just do the basics. Like when you go in for your interview, dress professional, look professional, hit the basics. Be clean cut, go in dressed nice, shake a hand, introduce yourself, and just be confident in your ability, and also leverage the fact that you're new, right? Sometimes some people like to fake it till they make it. Don't do that necessarily at an interview, but after you get the job, it's okay to be a little hesitant, right? You're new. Hopefully the onboarding process gives you more confidence. That way by the time you hit the floor, you're good. And hopefully even further back than that. Hopefully during the very last year of your nursing school program, you were able to build some confidence in some of your skills. But just understand, it's gonna be a new feeling. It's gonna feel awkward. It's an adjustment period. That is all expected when you're brand new into the workforce. So when it comes to making an impression, stick to the very basics. If you're a good, genuine person, you're a good, genuine person. Work on you, right? And then bring that person into the workforce, right? Show up on time, don't be late, don't call in sick all the time. And if you ask for vacation, be mindful of it and how it may affect other people, right? Help other colleagues when you have the opportunity, be helpful, be around, be engaging. Those are kind of all the basics that I'm talking about. Just do those and you make a good impression, right? Maybe also pick up a shift here and there just to help out, but don't get sucked into the world of overtime. But every now and again, hey, I can cover you, I can pick up that shift, and do that. Over time, you'll eventually get recognized as a good, solid worker. What I've seen in my career is, as long as you just do those basics, you show up, do your job well, it gets you recognized. What you don't want to do is be put on the radar as a bad worker, right? Do the complete opposite of all those things I said. Show up late, always call in sick, never help anyone out. Those are the things you don't want to do. So do the basics and you'll make a good impression. So here's another question. This one is by Nacho Cheese Brain 2461, right? Shout out. And shout out to everybody who put in comments and questions. Shout out to all of you guys. I appreciate all these questions because I can ask my own, right? I can say, the first time I inserted a Foley, what was that like? Or, the first time I encountered a very angry patient, or, the situation I felt like I couldn't handle, but I had to navigate anyway. I can come up with my own questions, but I really enjoy actual, real questions that you guys provide. Those are my favorite because now I know kind of what you guys are thinking about, and it helps. And it allows me an opportunity to just kind of help out as well, give a little bit more context to the value that I'm trying to add, right? I like that a lot. So again, Nacho Cheese Brain 2461. So their question reads, do you ever get overwhelmed at work? Honestly, I do get overwhelmed quite a bit. I know when I started in the county jail, feeling overwhelmed was almost like a baseline. I worked intake, I worked upstairs. Working in the county jail in general, it's a very unique setting. A lot of hostile patients, crazy environment, a lot of yelling. So yeah, I get overwhelmed. I get overwhelmed with staff, get overwhelmed with workload. And just in general, thinking back to nursing school, when I worked in the hospital, still got overwhelmed. So just know that that's normal. Oftentimes though, if your workload increases or you get a hard patient, hopefully you have colleagues around you and you guys can kind of lean on each other, right? That's where it kind of goes back to making a good impression too. If you help other people out, they're more likely to want to help you out. So when you are feeling overwhelmed, they may see that, they may ask you, hey, do you need help? Or you may be able to ask for help from them. Hey, can you help me with this? I'm having a hard time with this patient. I'm behind on charting. Those situations will happen, right? Sometimes you get a heavy caseload. So just lean on each other. It's okay to be overwhelmed. It's also okay to go up to your manager and say, hey, I'm behind on my work. I need some help. Maybe they can find someone else to help you too, right? But feeling overwhelmed is normal. I just want you guys to know it's okay to be flustered. It's okay to get stressed. It's okay to have anxiety regarding entering a nursing career, getting to work that day, getting to work that whole month, right? It's okay. It's normal. Eventually things get better and you see various situations. It's almost like the exposure over time gives you the confidence that you need. It sucks because the learning curve, right? You have to go through these fires and these trials and tribulations just to kind of get at peace, right? But just know, even when you're fully confident, there's going to be days that hit you and you're going to be overwhelmed. At the end of the day, as a nurse, you're caring for people's lives. There's always going to be a certain level of stress behind that. You know, it's just part of it, but just know it's normal. It's normal. And I think this is the last question. Zakari Yadar, 5613, and I'm sorry if I butchered that. But they ask, is it true that nurses only date doctors? Hey, I've seen a nurse date, a PA. I've seen nurses date doctors. I've heard about it. It happens. Whether it happens more often just because they're a nurse working in a hospital, I wouldn't say that. I would say nurses just like any other profession. Just because you work in a certain place doesn't mean you're going to date out of that pool. But it can happen. I've seen nurses date doctors, so it's not abnormal, but I wouldn't say it's the common theme. Most people who are working in their profession, some of them already have partners from before they got in the profession. So, it happens though. It's not abnormal or normal. I think it just is, part of it. Nurses often can date each other and other people. For me, I don't date a nurse, and I think a lot of nurses I know actually don't date nurses either, but some of them do, but not everybody. So that answers that question. Let me take a look and see if I missed anybody. Nope, and that is it, friends. That is it for the questions. I appreciate all the questions. I like doing these Q&A type videos. I'll sprinkle them in every now and again. And like I said, if I rambled on some topics here and there, I like to give you a raw take. Like if we're just sitting down, just chilling, just you and I, and you ask me these questions, I'm just gonna give you my raw take on it. I didn't want to think too much before I answered these. I just wanted it to be raw, just wanted to be authentic. Hey, you asked a question. This is the first thing that comes to mind. If you have any other questions in regards to this, you want a follow-up question, hit me in the DMs, comment down below. I'm trying to be here for you guys. I enjoy this. It makes me happy to see the community grow over time. 530 subs is pretty cool. Hopefully eventually it continues to expand and we'll see what it turns into. But I'll be here every week, friends, with a new video. As always, and as always, friends, continue on your journey. You got this. Whether you're trying to get into a nursing program, whether you're already in a nursing program, or whether you're already in the workforce or getting into the workforce, hey, we all are on this together. I'll see you guys on the next one.